Okay, we should for hey TV Ghana so not like comment no share money outside there. And you be a share na and then some no zipline. Aye. NDC4 time MPP are buying another than cocoa for the neighbor me am mo. Ever be introduced so say it became ma mo gare. E we gyan ye ho. Awa beto camera so na ade ade. Ana bisu asem na making. Kika sansim huni nyina kire Ghana for. And drones dey deliver bro ekum klase abeboa Ghana for. Eni no ACTV for no mo akasa kwakwa documentary on it. Ahwe ni impact. Amafo said the nurses and doctors of womb klase esi dan na do dan koku for no ba me amamu ase for this particular intervention no. Ese wani ese some catch up. Yanko ni koku
has encountered.
Everything new comes with some form of resistance. So when Zipline started, I'm sure some of us heard on the news that drones were going to be used to take photos of women bathing in the bathrooms and all that. And they've come to see that these like allegations are not like true because our drones don't even have cameras on them. And we've battled with a lot of like community acceptance.
However, 3 years since its inception, total units delivered from the 6 existing nets, including Omenako, Mpanya, Karachi, among others, stands at 1.5 million. The Omenako nest, for example, serves over 600 facilities, including the Noguchi Memorial Institute for Medical Research. Shmao Muniru is community lead for the Omenako nest.
When COVID started, it shook a lot of systems, and supply chain being like one of them. And Zipline has actually supported in that. The COVID pandemic hit us greatly. We were looking for more contactless supply chain methods, and the drone delivery came like as very, very important in doing just that. We've been able to deliver COVID-19 vaccines to health facilities and rural areas that need these vaccines, and also helped in augmenting the system of transporting COVID-19 samples to testing labs in Noguchi and KCC.
So far, deliveries have focused on hard to reach areas like Orebon, where cellular network challenges are prevalent. But with time, terminally ill persons in urban centers will experience the services.
We are looking to like revolutionize supply chain when it comes to health. We are looking at projects like the home delivery, where people can sit at the comfort of their homes and receive medical products. People who are terminally ill and cannot make too many trips to these health facilities sit at their homes and benefit from a delivery service that is almost like instant, more like medical teleportation. So we are moving towards that side. The world is moving towards that, and we look forward to these opportunities to serve our community.
Many chips compounds like the one at Orebon may not even have the storage facilities to keep critical supplies, but the next do. They store supplies from vaccines to oxytocin to blood, among others. Requests are made by health facilities through a software or via phone calls in emergencies. Monitoring requests by the minute to ensure swift delivery. Our fulfillment officers, who I observe are all young people. They package the critical supplies in parachute like boxes so nothing breaks when dropped by the autonomous intelligent drones. The drones do not stop. They drop the supplies and they simply return to the nest. But how do the drones land? I felt the excitement of the rural folks observing the action. From Omenako in Suhum in the
Amafo na che se omena ko de no eno no. Unze mo ekọ ne ko deliver na nurse ni ye de e ba be fine. Amafo en to aso. Omo to aso mo call eku bi e frɛ no Omeribon say I think that menye di ni ya amafo mo fan cheme. Omo kɔ no mo ne nurses bi mu so mo ho no me de edi nkomo. Omo so ensem of the two jan. Ye ko ni nkoti.
The hospital.
Jacobel Oponyeboa is in charge of the Orobon Chips compound. She says the Orobon Chips compound no longer uses the Aboboya ambulance, even though I didn't see a proper ambulance in its stead. The alternative? Well, that has been a subject the rural folks here speak of with animation.
Ọma sɛɛte ade no ɛnam wiem te aeroplane type
Mm.
no saa.
To one who be there?
Mahu but ebi wɔ no a na ade asa nti mehu ne clear. But matini so.
Send this.
Ayɛ sɛ ɔma sɛɛte na ade no ɛba but
So,
nnipa bi a ne wagya ade no ɛto hɔ no na ɔkɔ.
Obi antim.
Daabi.
Hello, Nunkuanam.
Nka kaa nko ade a hanom sei no anka ɛbɛdelay te sɛ ebi a yɛhia yi mogya anaasɛ biribi saa a anka ɛbɛdelay nka ɛbɛba no na anka nipa no biribi ayɛ no nti na adeɛ no a ɔmo ase ɛte no a ɛba no ɛyi no deɛ ɛboa.
It's the first time I'm here. I am saying.
Ehu na kwa no ehu no bi ahụ sɛ yɛ die ne sɛ na edunduro ne ba.
This is the Muhua.
Ne ehu ya no.
Is the Muhua in Yamohi?
Dabi.
When him say. They may not know its name, but it has been life saving. For Jacobel, the Zipline medical delivery services has contributed to the decrease in maternal mortality rates.
It has increased my output here. Output at the maternity unit because they were having one delivery per year. And then from 2019 was a little bit, I was around 62 per year. And then 2020, I jumped to 74. 2021, I jumped to 84, and now I'm so on it. So I think with the aid of Zipline, the name of Orobon chips will continue to be higher and higher. Let me say that. Yeah.
Okay, Omanfo, na kyerɛ sɛ ɛyɛ nurse ni no so the analysis or realize it since Zipline no ɛyɛ de started di nnuro ɛbrɛ wɔn mo no yes analysis no ɛyɛ de ɔde tu dwa no kuro ne de ɔrebɔn yeah we are ɛyɛ kurase po a wohwɛ adan sisi wɔ koraa itumi sɛ ɛyɛ kurase paa but you see mu na ɛnyɛ abɛnɛfiti from this particular initiative ɔmo tete hɔ a ndc foɔ na ɔmo ka deɛ ɔmo yɛ ɔmo afɔ yɛ kɔ hanom sɛ nso a ha nso ɛyɛ esirem ha nso medical doctor a ɔwɔ baptist medical center ɔyɛ narelugu community and its enclave na sɛ nkuro atwitwa ne ho ahyia this is one of hospitals a anaasɛ medical center ɔmo nso benefit from what the drone delivery system ɔmo afɔ yɛ nkɔ nkɔ tie medical doctor no yɛfrɛ no Dr. Isabella Amesi.
We meet Dr. Isabella Amese.
We use Zipline for a variety of services. They deliver vaccines to us, they deliver medications we don't currently have in stock, they deliver blood and blood products to us at all times of the day, odd hours of the day. Whenever we make requests, we get deliveries brought to us. Promptly, within an hour, we get our deliveries.
Dr. Isabella Amese confirms what the regional minister told us.
Over here, all we have is usually whole blood. But since Zipline came in, whenever I need fresh frozen plasma, it's delivered to me within the time frame that I need it. So instead of referring patients who have clotting issues to Tamale, I can take care of them right here in the comfort of my hospital with the help of Zipline.
No wonder the whole of this year, the facility has referred less than 5 maternal cases to the Tamale Teaching Hospital. This is a clear departure from the past. Aside the VOPSI base in Wale Wale, the drone services are operational in Omenako in the eastern region, Mampong in Ashanti, and Seshioso in the western region. The Zipline technology has brought health professionals so much relief.
For me in particular, in DMC, being somebody that is heavily relied on, time is a big issue for me. with Zipline, I am able to do as much as I can within the 24-hour time frame. Because we don't have enough doctors, I'm currently the only medical doctor in the facility. We most of the time rely on local doctors to help support me. Sometimes we get those people, other times we don't. And so you can understand that they are calling me here, they are calling me there, and then my time is very valuable. So if I those days there are some cases that you feel that you will spend a lot of time on, and at the end of the day you may not get good results. So those were the cases that eventually we would have to refer. But like I said, now with Zipline, I'm able to get what I need to take care of those patients, and the monitoring is done with the help of the nurses that I have on the ward. And that has really helped me a lot. I feel that their services, I must say, I'm very grateful they came along.
She will say that she's very grateful. This is from medical doctor. It is NDC for better TV so no do so. I can do all there. Ebi kwasi etie wo mo. A visionary leader and the be introduce so adiwi. The way you see them all, Jordan man Mahama be president, wa anwe ne ho da. Se ni kurom fo kra be hia bibi se. Ene wa kwasa ba. I say ope amamu no. Your man 24-hour economy. Na Zipline no, maame ba ko okasa e wo say ote se esu anadwo. Enye 24-hour economy ni bi no. Enam anadwo cho. Me ye adwuma 24/7 always be a. As I employ youth, this is what we call visionary leadership. And yeah, for the EB. Mama for a quarter so we a testimony from a university graduate. I know a yare. I know we hear drew giddy giddy wu. But enam drones inti. Timi send a drone call a classy and now war. Emma, it's me the agent. I'm for Yanko on one casa and a kind of story. Yanko Ninkuti.
My name is Ivan Sinkitia, a graduate from Sunyani Technical University. I studied building technology. On the 27th of July, I was very, very sick. I got to the drugstore in town to get some medication for myself. Around 6 o'clock, I couldn't even feel myself on the bed. My temperature was very, very high, so I tried calling my cousin to pick me up to the nearest clinic. When I got there, it was worse. I couldn't even feel what was going on. The only thing I could hear was people screaming and
So vital signs, everything was checked, but still his condition was getting worse. And we needed to administer medication so that we can keep him very stable. But due to shortage of drugs here at our facility, we ordered some drugs from Zipline.
We had a call from Yonso Health Center, which is a facility that we serve at GH2, ran out of stock of artemether injection 80 milligram, and they called to place an order for that. Within minutes, we processed the order and sent it to the health facility.
the next thing I could hear was, it's in, the medication is in.
And within 15 minutes, the drugs was delivered to our facility and it was administered to the patient.
The next thing I was back to life. I felt myself. I felt I'm a little bit okay. It really saved my life, and it's really saved a lot of people's life too in this community. So we say thank you.
For we the new being a catch say a idea a beboa Ghana for. See one a idea a beboa we need here, near maybe see me here. Idea Jimmy Pankwa. So yet was one a Dr. Mamu Belmia and so added to get our hand see, I say, ye baby, nationwide, to see an introduction into a more focusing on villages being near there. This is you know, more vision say, on the some year, on the coin. Ghana afa na nyinaa na obi ayɛ de benefit yɛnkɔ ne yɛnkɔti.
Looking back, there seems to have been some foresight on our part to leverage on technology. And this is why, I believe that developing countries have more to gain, the upside, using technology than even the developed countries.
We use Zipline for a variety of services. They deliver vaccines to us, they deliver medications we don't currently have in stock, they deliver blood and blood products to us at all times of the day, all hours of the day. Whenever we make requests, we get deliveries brought to us promptly.
Aside the Vopsi base in Wale Wale, the drone services are operational in Omenako in the eastern region, Mampong in Ashanti, and Sefioso in the western region. The zipline technology has brought health professionals so much relief.
Because of the nature of our operation, we are better placed to be able to serve at speed the anti-snake and anti-rabies more, because those are things that you need quickly, and the patient will need it. And in a matter of seconds, the patient may lose their life, so we are better placed to be able to serve those. So we get quite a number of those orders.
The help of Zipline. Now we don't usually do the referral. If you can get the drugs from them, that is if they have in stock those drugs. So we just order those medications, and within 10 to 15 minutes, it's available when we administer.
Their impact was felt more, especially in the heat of the COVID-19 pandemic.
With COVID, the drone started flying samples from the hinterlands to Omenako, and from there continued by road to Boguchi, so that they could test in good time to take results back. Phenomenal.
For doctors and their nurses, their joy is from the fact that referrals to bigger facilities have reduced. There are plans for the drone service to cover the entire country.
We are hoping that next year we will have coverage for the whole of Ghana. Right now we have 4 main centers. We need an additional 4 centers for 100% coverage of all of Ghana. And I think it's very, very important. I hear a parliamentarian, in fact, made that request that we should get coverage for all of Ghana. And he wasn't an MPP parliamentarian, he was an NDC parliamentarian. And it's good that that thinking has changed about how helpful the drones have been. We are at a cutting edge of technology, and Ghana is one of the leading countries in the world.
Okay, your man for yes, and I don't remember me a two Ejano, Sicino, target say be Amagana, Kumayina, Ubiade, and Yabi. Now, all children no chess, NDC for MP, na Freedom Margin, Assessor, of NDC MP, and never catch it almost say a bebuapa na a buapa anti, a woman named Ragana, and Yamona, Mohana Bisu, Bega say, if you chop my home, a mom will be a reward. Look at this. A man for high TV and also comment or comment section.